So in this video, we're going to talk about how to diagnose adult ADHD, how to know if you have it. We're going to talk about what are the actual root causes of adult ADHD, like why does this happen? And then we're going to talk about treatments and options for making your adult ADHD better and kind of easier to live with. And so if this is interesting to you, then I invite you to subscribe to this channel and like this video because I have a lot of content similar to this. And at the same time, it's important to disseminate psychological content on YouTube because there's a lot of videos on YouTube, and I'm really hoping that individuals who struggle with these issues are able to access content like this so that they can improve their lives and maybe understand their own minds in a more optimal way. Okay, so now that you've done that, let's get into adult ADHD. So adult ADHD is different from childhood ADHD in the fact that it is in adults, just like it says so in the name. But also, adult ADHD often presents differently than childhood ADHD. One of the biggest differentiators between adult ADHD and childhood ADHD is that typically adult ADHD doesn't have that hyperactivity component. So adults typically have that more developed in that they can control their impulses slightly more, so not to kind of get up out of their chair and walk around when they shouldn't, versus children do have that hyperactivity component, which is often more easy to detect and kind of easier to see when it's playing out. So sometimes adult ADHD can kind of fly under the radar. So we know that in the population, childhood ADHD is about 8% and adult ADHD is about 4%, with a 2-to-1 ratio of men to women. So twice as many men have ADHD as women. So what often happens is that there are higher rates of childhood ADHD because ADHD is actually something that you can grow out of. It's something that can improve as somebody matures, as a brain matures. So one important thing to remember about adult ADHD is that it is highly unusual and very improbable to have adult ADHD if you did not have childhood ADHD. So if you did not have components of ADHD as a child, then what you're experiencing now most likely is not adult ADHD. So with that said, let's get into the kind of diagnosis criteria. I'm not going to go off of the DSM here because that can kind of be a little bit hard to relate to. What I'm going to go off of is Dr. Russell Barkley's diagnosis criteria for adult ADHD, and he's one of the leading researchers on adult ADHD. I will link his book below if that's a resource that you think might be helpful to you. Okay, so I'm going to go through these and just kind of think about in your mind if you experience any of these symptoms. And just keep in mind that in most psychological diagnoses, you're going to see a little bit of yourself in each component, but in diagnosing psychological disorders, it's really important to understand the frequency. So typically the difference between someone that's in the normal population versus someone who actually has a disorder is that someone who has the disorder has a much higher level of frequency of the symptom in a way that disrupts their life. So that's kind of the difference. And I know a lot of us often kind of hear ourselves in psychological disorders, so that's why I say that. Also, major disclaimer here. This video is just meant for you to kind of maybe explore if this is something that you need to go seek medical attention for. This will not actually give you a ADHD diagnosis. Only a medical professional can do that, or an ADHD specialist that specializes in diagnoses. So you actually do need to go see someone to receive an actual diagnosis. This is more like maybe like a screening you can do for yourself just to see if this is something that might be helpful to you. Okay, so here we go. So ADHD often has 3 separate areas of symptoms. So I'm going to go through each one, and you might or might not kind of see yourself in these. If you see yourself in a lot of these, then that might be an opportunity to go get some screening, because if you do, ADHD is actually a very treatable psychiatric disorder. So once you kind of have that diagnosis, you can actually get treatment, and it can actually make your life a lot easier to live than it is right now, because living with untreated ADHD can actually be quite difficult. Okay, so do you have short attention span or lack of persistence on tasks? Meaning You are especially persistent when you consider something boring, or you just have a hard time focusing on anything that you might consider boring. Do you shift from one uncompleted activity to another? Do you lose your concentration during a long task? Okay, on to the second criteria for symptoms. So this is the inability to control impulses and delay gratification. So do you often not look before you leap? Do you tend to interrupt others, or just kind of blurt out comments that you regret, or tend to dominate a conversation? Do you tend to overspend or overeat when you're trying to save money or maybe lose weight? Do you speed or drive in a very aggressive manner? Do you have a lot of parking tickets? Do you generally just have a very low tolerance for any type of frustration? All right, and now for the third area of symptoms, and that is excessive or uncontrolled activity. So were you fidgety as a child and needed to move in a way that wasn't necessary to the task at hand? Do you need to always be busy now as an adult? Do you have a sensation of constant restlessness? Okay, and so if you saw yourself in these symptoms, remember that in order to have an ADHD diagnosis, not only do you need to go to a medical professional, but also you need to actually be impaired by these symptoms. And this is really important, and this is something that I think isn't often talked about in psychology enough. But consider the fact that all psychological disorders are constructs. They're constructs by people. And so we've all kind of gathered together and we've decided that this is a disorder, that this set of symptoms is a disorder. And consider that we live in a certain type of culture right now, in a society that really values time efficiency and productivity and output and all of kind of those things, planning ahead, that are not very conducive to ADHD symptoms. There is the scenario where there could potentially be a culture in which ADHD would actually be a massive strength rather than a weakness. And I do believe there are strengths to every psychological disorder, to anything we call a psychological disorder. So please remember that this is not like necessarily something completely wrong with you. This is just a box that's been kind of carved out in our diagnostic criteria that we've decided that having this set of symptoms makes it more difficult to live a life that is considered optimal in today's culture and kind of our society. Okay, so I think it's really important to have that disclaimer. And so a couple more things about ADHD that might be interesting to know is that oftentimes ADHD can sometimes be confused with autism because individuals with autism have a difficult time reading facial expressions or social cues, as do individuals with ADHD, but for very different reasons. So individuals with ADHD oftentimes have a hard time picking up on social cues or facial expressions because they have a hard time storing those in their working memory. So essentially they have a harder time just keeping that information in their heads. And that's why oftentimes they just don't pick up on certain emotions that others display or certain social cues. While individuals on the autism spectrum have a deficit in what we call theory of mind, which is essentially the ability to imagine what another person is thinking and to kind of imagine their mental space, their desires, their emotions, their needs, etc. So these are a little bit different because the issues with ADHD stem from issues in executive function. So essentially there are deficits in what we call executive function that are the root cause of ADHD. So what is executive function? Executive function is essentially this kind of term we have in neuroscience to name all of the processes in the brain that are related to planning, self-control, inhibition, and anything that really kind of like makes you create a better world for your future self and not necessarily partake in activities that are feel good in the moment or potentially hedonistic. And so executive function is made up of several subcategories. And in ADHD, there are deficits in 4 particular subcategories of executive function that are really helpful to know about. And once you know about them, it's often easier to kind of look out for them and to understand why you do things. And I really think that knowing what parts of your behavior are potentially ADHD or ADHD-like behaviors is really beneficial to kind of helping you change your behavior, changing your mindset to create a life that you prefer. So one more important thing to understand about ADHD is that with like all psychological disorders, in ADHD, we have something called subclinical ADHD. What that means is that essentially someone presents with certain symptoms of ADHD, but not enough symptoms to be qualified for a full ADHD diagnosis. In psychology, we sometimes say that individuals who are subclinical often suffer the most because they actually have quite a few of the symptoms that lead to suffering, but they are not able to get enough of the symptoms to receive the treatment that is so crucial to receive to alleviate these symptoms. So it's like this weird gray space where you feel bad and you're suffering, but you're not quite suffering enough to receive treatment. So if you have subclinical ADHD, you will not have the ability to have medication subscribed to you. You will not have necessarily the ability to have insurance cover your counseling or therapy. And you'll kind of be like in this limbo space where you might have a lot of troubles engaging in everyday activities that would benefit you, but at the same time, you can't get the kind of evidence-based treatment that we know is really beneficial. So if you are someone that is experiencing this, then there's quite a few behavioral interventions that I'm going to talk about towards the end of the video that might be beneficial to you, and those are kind of your best bet to feeling better. Okay, so executive function. And this is really at the root cause of ADHD. A lot of people don't know this, but essentially ADHD is like an inhibition control disorder, in that essentially individuals with ADHD have a very hard time controlling impulses. And that is at the root of the disorder. And so with executive function, there's many subcategories, and there are 4 subcategories in which there are deficits for individuals with ADHD. So first of all is nonverbal working memory, which is your ability to kind of hold things in your mind and remember things and kind of use those to predict future outcomes. And so with individuals with ADHD, we often see that they're not able to engage in what we call vicarious learning, in which we see other people do things and we kind of see their mistakes, and we learn to not do the things that other people did that led to failure. Individuals with ADHD often can't really hold those in their minds, and so we see them kind of engage in more mistakes in their lives just because they can't engage in this vicarious learning process that neurotypical people can. Similarly, they also have deficits in verbal working memory, which is essentially tied to our ability to engage in self-talk, particularly in beneficial self-talk. And what this means is that oftentimes when we think of doing something, we have kind of this voice in our head that's like, oh yeah, maybe I shouldn't do that because it's a little too risky. Or maybe like, you know, if I do this, then it won't benefit my future self. So because there's deficits in working memory for individuals with ADHD, they often can't really engage in that long-term self-talk or that beneficial self-talk that allows them to plan for the future or protect themselves from risky behavior. At the same time, individuals with ADHD also have inhibitory control issues in which they just tend to take more risks and have a higher propensity to just be more impulsive. So they might have that kind of sensation where they feel something in the moment, they like want to do something, and they don't have that ability to override that sensation because they know it's not the best for their future self. And speeding is a really good example because oftentimes we know like, oh, if we speed too much, we'll get, you know, a ticket and it'll not be great. But if you know, you have ADHD, you can't really override that desire to speed because you don't project so much into the future consequences of that behavior because you just don't have that kind of inhibitory control that is part of the executive function of a neurotypical person. Furthermore, individuals with ADHD often lack cognitive flexibility, in which they're they just have a hard time kind of holding all of this information in their minds and kind of organizing it in a manner that is beneficial to them. So it's just a lot of burden on the mind of someone who has ADHD to organize information, to keep information in the brain, and to perpetually re-access the information, which is why it plays out also as having issues in social situations in which there's just a lot of information when it comes to interacting with humans, and all of the things we say, all of the social rules we have, all of that kind of information that the brain needs to process in expressions and tone and mannerisms and all of that. Oftentimes what's also seen with individuals with ADHD is that they can present with a high level of rigidity because their rigidity essentially protects them from having to be cognitively flexible, because that cognitive flexibility is just really burdensome on the brain. Okay, and so the reason that I'm actually making this video is because I had a comment on Reddit asking more about adult ADHD and how it relates to dopamine. And so we know from research that ADHD essentially is an issue with dopamine and norepinephrine. And that means essentially the brain of an individual with ADHD is not receiving sufficient quantities of dopamine and norepinephrine to be sufficiently stimulated and kind of aroused to maintain focus and to engage in these kind of behaviors that we see with executive function. And what that means is that there are lower than average dopamine levels with individuals with adult ADHD. So it seems that it's not an issue with dopamine production, it's more an issue with dopamine density and how much perceived dopamine there is in the brain, in which there is just not enough density of the dopamine there. And so this is something that the ADHD medications target, Ritalin, Adderall, things like that, in which they do increase dopamine and norepinephrine in the brain, and they allow an individual to have what we would consider more normal levels. I'm not going to talk about too much about medication in this video. That's kind of outside of my scope. I think the book I linked below does a really good job of talking about this. Just one thing that I do want to offer is that now there are non-stimulant types of medication for ADHD. So essentially, if you are someone that doesn't want to partake in those highly regulated stimulant medications, then there are other options for you now. So, and the book I linked below does a really good job of going into that. Okay, so outside of medication, what can you do for adult ADHD, or just if you are someone that identifies with a lot of these symptoms and you feel like you could use some help, you feel like you're not someone that seems to have a normal experience when it comes to impulse control and focus. So almost all of the recommendations for ADHD essentially have one kind of root explanation to them. And that is, what you want to do is you want to get as much things out of your brain as possible. So basically, you want to outsource as much of your kind of cognitive processes as possible to the external world. And what these look like is really like setting up a lot of reminders for yourselves, lists, notifications to engage in the behaviors that you know are beneficial to you. So that can be even like putting something on your wall, like a bunch of Post-its. It's something that you need to see on a regular basis. Engaging in a lot of mental cues that allow you to outsource what kind of a neurotypical person would be able to do in their own minds. And so maybe someone who's neurotypical can hold that information in their mind, but as an individual with ADHD, you really want to externalize as much of your mind as possible. And that is really the root of all the beneficial interventions. And so different people do this in different ways, but what I want to offer is that sometimes we can feel a little bit of shame when we have to do these types of things, or maybe we have the mindset that we shouldn't need to do these things. Like, I shouldn't need to put Post-its everywhere. Like, gosh, what's wrong with me, right? And I really want to make sure that everyone understands that we all have weaknesses that we need to work on. So if you're an individual that identifies as someone with adult ADHD or subclinical adult ADHD, and you're kind of fighting this like need to externalize your mental processes, I would really look at that and consider like, why do I feel like I shouldn't have to do this? Because as we all have weaknesses, it's completely okay to compensate for our weaknesses. It's completely okay to need to rely on some external cues. And I think it's really important for all of us to consider, like, the world we live in today is not necessarily the world that we evolved into kind of in an evolutionary biological sense. And so there are a lot of distractions and a lot of things that we need to hold in our minds these days. And honestly, even neurotypical people are having a hard time holding all of this information in their heads. So I think it's really important for all of us to accept that this may not be normal to have to hold this amount of information in our minds. And it might be more normal that we actually do need to externalize some of the cognitive processes of our minds. We might need to put up reminders because we're holding a lot and there's a lot of information that's coming in. And each year it's like more and more. There's more ways to receive information. So I know that that's just my perspective, but hopefully it's helpful to anyone that's kind of struggling with this. Please don't think that this is something that is wrong with you or that you shouldn't be doing. This, I think, is something that maybe all of us could benefit from. Like, we could all benefit externalizing a little bit of all of the things that are in our minds, because we have to hold a lot these days. So when you're thinking of strategies to help you externalize the things in your mind, just consider that it's really anything that works for you. Anything that you can just use to remind yourself of the things that you want to do for your future self, anything that you want to remind yourself to work on the goals and projects that you have, because sometimes it can be difficult to have that motivation and to have that focus when you're an adult with ADHD. And as I mentioned before, this video is based off a question I received off of Reddit. And so if you have something you'd like to have me talk about in a future video, please comment below or shoot me an email. I'm always happy to make videos based on what is interesting to you all. So I hope that this was helpful, and I will see you all next week with another video. Take care all.